We're going to talk about the irrationality that often comes with the perception of BPD that you might be contending with, but also the rational perspective of BPD that many people in your life or those who don't have BPD tend to apply to it. And I think this adversely impacts the understanding of those in your life about how BPD functions. Now, it's not a fault of theirs. It's nothing that they're doing wrong, right? A lot of times, and a lot of us try to apply a very rational understanding of what's going on in the world. So we also have to look at beating BPD and what that entails. So I want to talk about the rational and irrational perspective first. BPD tells you or your loved one or someone you know that the world works like this. 1 plus 9 plus 42 equals 3. How could that ever be possible? It's not. But that's how BPD functions in your brain. It's very manipulative. It's very tricky. And did you know that if you were told from a very young age that 1 plus 9 plus 42 equals 3, you would eventually believe it. Just like if you're told you're broken, you're a loser, you have nothing, everything you believe is completely false, and everyone around you is going to leave you. All of your friends and people of value are going to reject you, and you are destined to have this internal sense of emptiness no matter what you do. That's BPD. That's daily BPD, and it hits you every single day. And if it would just like walk up to you and punch you in the nose, it probably wouldn't be that bad. But it doesn't, because it's manipulative and it's tricky. And the way that it does it is that it might first tell you something maybe nice or maybe something kind of softer, not as intense. And what you do is you kind of put your guard down a little bit and you're like, oh, yeah. And then it says, yeah, but the whole reason why that happened is because you're a loser and they're doing something behind your back, or they're going to cheat on you, or they're going to break your heart, or they're going to abandon you, or they're going to reject you, whatever it may be. And let's apply this to your partner. Let's say, right, that you and your partner, you're having a hard time. Things are difficult. Things are stressful. And it happens. Every relationship, there's stress. Every relationship, there's miscommunication. But what BPD says is, right, during that communication, not only is it your fault, but everything you're doing is wrong. So then let's say that you sort of get a handle on it a little bit, right? And things are kind of quiet for a minute. And then when things are kind of quiet, that same BPD might say to you, things have been kind of quiet. That's great. That's really great. Probably because they're planning on leaving you any minute and they're just going to kick you to the curb, and then you're not going to have anywhere to live. And then that means you're going to be homeless. And when you're homeless, then you're going to feel empty because nobody ever wants to hang out with homeless people, which is absolutely not true. And here's the thing. So when you bring up stuff with BPD, then you get confused because 1 plus 9 plus 42 equals 3. It doesn't make any sense. So, but you spin, and because you heard it for so long, you believe it. Because we are adaptive creatures. Human beings are adaptive. So because we're adaptive, we adapt to something even if it's false, even if it's maladaptive. So here's the other side. Now, your partner, your parents, people that don't have BPD or don't have the same type or same severity of symptoms, right? When you're explaining things, or maybe your behavior or your reaction or what BPD is like, they apply a rational lens because most people are rational. Now, it's also from their own perspective. That doesn't mean they're narcissistic, doesn't mean they're egocentric, doesn't mean they're horrible human beings. It means they're a human being. Because we all tend to look at the world with our own lens. It's just how we work. That's just how it is. And we set up our life to validate that lens. I don't care if you have BPD, if you have NPD, narcissistic personality disorder, or if you have no PD or depression. People with depression do it. People with anxiety do it. People with no mental illness at all still do it. So most people are rational. So what happens is when you apply a rational lens to BPD and how it operates and what it says to you and how it impacts your relationships and how it drives particular maladaptive behaviors, then the other people in your life are like, well, just don't do that. Don't do that. Wouldn't it be great if it was that easy, right? It would be like let's say you love chocolate, right? You're like me, like you love chocolate. I love chocolate. And if you ever see me on an airplane, you can be sure that I have a small bag. Usually it's peanut butter M&Ms, but sometimes I'll treat myself and I will get dark chocolate covered almonds. So it's a treat. It's for me, right? So it's like I'm going to have that chocolate, right, in my backpack, in my bag, and I'm gonna be like, nope, nope, I'm not gonna eat it. Nope, nope, nope. That's gonna be a really rough flight for me. It's gonna be really, really hard. Could I do it? Sure, I probably could. I mean, I guess, but I'm probably gonna cave, right? And what happens is we get driven to that. But when you look at it through that rational lens, you'd be like, well, just don't buy them or don't eat them. They're already there. They're already in the bag. I prepped for it, right? I have Raisinets for my upcoming trip next month already in my pantry. I mean, they were on sale, it was a good deal, but besides the point, they're already there. I'm a big prepper, preparer. Maybe you are too. So here's the thing, that rational view says, well, that doesn't make any sense. Just don't do that. That's a rational perspective of an irrational conceptualization, which is BPD, PD, mental illness. I'm not saying those people are irrational. I'm saying the perspective and the diagnosis because it drives these particular internal thoughts, beliefs, behaviors, which drive patterns, which are continually destructive. So when we look at it through a rational lens, it doesn't make any sense. You think, well, just don't do that. It's just not that easy. And we're not saying those people don't care. We're not saying those people don't understand. We're saying they're using a different lens. We have to help them understand that. Because when we are working on BPD, like I do with my clients, we work on BPD, how they perceive themselves, how BPD presents itself in their head, right? Even though we all have a family in the head, individuals with BPD, OCPD, right? NPD, any personality disorder or without, we all have that family in the head. But if we have that PD part, that mental illness part, it tends to skew intensely negative. So we gotta push back on it. We gotta explain to the other people that are in our life, I get where you're coming from, but you're adding a very rational lens to an irrational perspective. It's like putting on a pair of really foggy glasses and then driving down the road and thinking, there's no problem in doing this. It's going to totally work out. That's the rational perspective trying to make sense of BPD personality disorder. It's the same thing. It's foggy, it's view, it's out of there, but you're saying, well, that doesn't count. And you could also say, well, don't put the glasses on. Shh. We don't have time machines. We can't go back in time. Whether those traits or full disorder is still there, it's there. So that means you got to deal with it. And in dealing with it, here's what you got to do, right? You're gonna feel like Sisyphus. Now, who was Sisyphus? You're like, what? Well, huh? What? Who? Huh? What? Sisyphus was a Greek figure, okay, who was condemned by the gods to an eternity of futile labor. Now, he was tasked with pushing a boulder up the hill. Now you're like, oh, yeah. And well, I'll show you a little picture here of it, right? Only to have it roll back down every time he neared the top, forcing him to repeat the task over and over and over again. That's BPD. It can feel like that's BPD. Every time I get to the top, every time I think I got a handle on this thing, well, that darn ball keeps rolling back to the bottom, and then I got to keep starting over. Here's the thing. Now, we're not Sisyphus. So here's the thing. It might feel that way, but that boulder is getting smaller. That boulder is turning into a rock, and that rock is going to get to a size where you can grab it and be like, well, heck with this, and you're just going to chuck it. Just chuck in a rock. Bye. Because that's what we're going to do. We are going to turn it down to where you can control it. And instead of pushing up that pebble, you are going to get control of it. And that's what it's about. It's not about a cure. There's no cure for the common cold, right? There's no cure for many medical illnesses, right? Regretfully. And there is no cure for personality disorders. Before you're like, what? Right. But there is management. There is management for flu. There's management, right? For all these other disorders. Mental illness is the same way. Personality disorders is the same way. Cure means it's present. You apply something, presumably, and then it goes away forever and you don't have to worry about it. So now we're talking about something much more complex. We're talking about a personality, right, disorder. The disorder part is that these maladaptive beliefs, behaviors, and patterns have somehow gotten into your life where you conceptualize the idea of 1 + 9 + 42 = 3. So we got to unpack it. We got to make it smaller. So you're not always pushing up this giant boulder up that hill. How do we do that? That's keeping you motivated. Recognizing that this is something that you can control and manage. BPD is the most successfully treated personality disorder. There's 20 years of research to show that. You can look it up on Google Scholar all you want because it's right in there. Absolutely. I have amazing success with my clients and they work so hard and it is hard and it is not easy. You think Sisyphus had an easy time pushing that darn boulder up there? Absolutely not. It's tough. But just like that boulder becoming that stone, that pebble, you can make it easier, and that becomes the management and control, and it's being motivated. It's hanging on to it. It's not giving up on yourself, not giving up on having healthy relationships, not giving up on overcoming the pathological approaches to managing and dealing with your life, because you absolutely positively can. Absolutely. And if you're watching this for a loved one, you can help them do that. Recognize that what they're dealing with is an irrational conceptualization. Don't apply the rational perspective and say, well, just, just don't put the candy in your bag. Come on, it's not that easy. Come on, it's not that easy, right? No way. So what we got to do is we got to look at it from that irrational perspective, see where it's coming from. Then we've got to start making that stone smaller, and that requires motivation, staying dedicated to it, and always, always working towards adaptive strategies for the problems and issues that are going to come up in your life, their life, and everybody else's. And because you have a problem that is outside, that does not meet your expectation, that does not mean you're broken or that you're doomed or anything like that. That is BPD, family in the head, telling you to keep pushing that stone up that hill. Stop it. Let's make that stone smaller. And that's what treatment and therapy is all about. I hope this was helpful. Check out some other videos, and I'll see you next time. Bye-bye.